presentation. Chris Parm is the hospital supervisor that will be listening to my presentation, and Holly is going to be our recorder and pressing my slides as we go through. So basically it's a strategic planning presentation. So next slide, please. So this was our first assignment, was the SWOT analyst. So basically go through the strengths, weaknesses, opportunities, and threats that we want to go through. My topic was communication. So I wanted to improve interdepartmental communication through hospital through the education and training, and this will all happen within a year's time. So I just kind of went through just a couple points of strengths would be everyone's ultimate goals for patient care, the dedicated health providers, leadership empowers staff to create new and useful policies. Some weaknesses, just we're rotating staff so much, short staff on the floor, time to complete required educations is sometimes hard. Some opportunities that we have, external environment, would be providing education for clear and concise communication would be a good one. Transferring patients throughout hospital comes more easily would be a good opportunity. Some threats that might actually hinder us would be censuses at the hospital would be at full capacity, which means less time to actually communicate with each other because of our patient load. Just keeping up with healthcare needs and healthcare trends. So that's okay. So next slide. So basically went through a stakeholder analysis, which basically is I'm going through stakeholders, which would be everybody that would be involved in the communication. So this would be the nurses, both in the med surg, the ED, the outpatient, hospital supervisor, environmental services, transport, leadership, patients, and providers. And then also the other points would be the power and interest, level of support, and then reasons for resistance that maybe some groups might have. So a lot of the nurses would have direct level of support for the patient for the reason for communication. Leadership, obviously, to maybe manage census technologies that they want to bring in. Possible reasons for resistance is their patient load, too busy to really complete a communication transferring. And leadership, again, cost for technology. And then for the patient provider, just having to repeat information over and over again. We've seen a new person each time they come into the next slide. My strategic map includes the financial, customer, internal, learning, and growth, which all accumulates that would be affected by communication. So next slide. And then I've connected how different things that would influence the financial, customer, learning, growth, internal, and communication. For financially, we would increase the revenue, lower costs. Learning and growth would improve knowledge, improve tools and technology. Internally, increase relations, increase efficiency, and customers improve patient outcomes, and it would lower the transfer times. Next slide. So the strategic plan, I was going to call this the 3 C's, but it's consistency, communication, and clarity. So basically, consistency. It's just basically just making sure our organization in every location has the same policies and procedures. So anyone could actually float to a different location and still expect the same regiment. And basically know that they can just jump in, they know how to report off, they know the care of the patient, the routine of the patient. It'd be a lot easier to actually be able to transfer throughout and know what's expected of the nurse or the staff that's going to take care of the patient. Communication from leadership, it's basically using the vernacular that is easy to understand. So depending on what audience, the way you speak to somebody is going to be different than you speak to maybe a patient or to a staff member. So just making sure your communication is appropriate for your audience. And then for clarity, it's just making sure that you're clear and concise with the information you're giving. So it's just making sure that there's no extra jumbled words, so nothing can be misinterpreted. So it's just clear, people know exactly what the plan is, and if they do have questions, that'd be easily rectified with a couple of explanations. Next slide. So a business model that I was looking into was to demonstrate value creation, generate business model options, identify the risk for each options generated, prioritize the risks, reduce risks through business experiments, and organizing for incubation. So first is demonstrating value creation. So what we really want to do is figure out the vision that we want, what needs improvement. Secondly is generate business model options. So just kind of seeing what would work, what other plans that we could kind of institute, and just kind of gathering information. Identify the risk for each option. So it's basically figuring out what's going to fail, what's going to work in your certain situation. Prioritizing the risks. So that's just basically looking into, for our setting, it would be our patients at risk. We really wouldn't want to use anything that would put a patient in risk or that would even question the facts. So we always want to use evidence-based practice. Reduce risk through business experiments. So this is kind of our trials. So just kind of putting it into use, getting feedback, implementation, just checking to see if the plan actually works. And then organize the incubation. So it's just kind of coming back, reevaluating if the plan worked and if it's even worth kind of spreading out throughout the organization. So that is my SWOT. I'll even do my references page. Do you have any questions?
No, I do not.
Okay, well thank you.
Good job.
And that's my presentation, thank you.